All right, so I'm gonna spend some few cases on the TAVR CTA. I did not prepare full slides as other speakers did, but I wanna do a few things with you with some hands-on sessions. So let's go to the TeraRecon. So if you just follow me, and then we can practice that together. We're gonna show how we do the calcium score quantification for the aortic valve. Before we do that, I just wanna echo a few points. So when we measure the aortic valve calcium score, it has to be the valve leaflets. There are a few things we have to avoid. If you go too high, you might involve something in the sinuses or the sinotubular junction, so that should not be included. And then if you go too down sometime, where the LVOT calcification or even the annular calcification of the mitral valve comes up to the LVOT, so that's something you need to avoid. So again, the teaching point, don't go too high, don't go too low. And sometime when we measure, you want to avoid also some adjacent coronary arteries that the calcium might come in. So you want to be meticulous about it. So, I would assume everyone has this a screen. So from there, you're going to go ahead and double oblique your aortic valve. So your cursor, crosshair, just go ahead and double oblique your aortic valve. So you create a short axis, should be at the left top. And you just scroll back and forth, and now you have a better understanding of your aortic valve. Everyone is there. Now you go. So on the right side, you see options here. So this is the calcium score following the Agatston units, and the 130 Hounsfield unit is the cutoff. So you have to select it in your setting. You see the contrast. Everyone sees that. You see my cursor. You need to change this number to 130. And once you save it once, it should be in the system, by the way. So from here, this is the circle that's supposed to be the aortic valve. You see how we are far? So if you hover over the aortic valve circle for the calcium, you just carry it over the aortic valve. And you start from there, and you start scrolling up and down, up and down. So let me just ask you here, are we happy with the circle? Let's say you don't agree that the valve calcium should go this level, how to adjust the height. So on the bottom, right and left, you can adjust how high and low you can go. So if you hover over your top and bottom of the box, it becomes green. So that means you can hold and adjust the height. So if you go ahead and just for the practice, do that. And from here, you can go back again and confirm that, actually, yep, I agree with that. Here, the aortic valve started. I agree with that. Let's keep going. Let's say you don't want to measure this calcium, just hypothetically. How to adjust this? You go again to the valve level, and you say, I'm going to come down on the upper edge of the valve, and you start coming down, let's say, to here. And now you're still including that, so you need to come further down. You come further down, and now you excluded that calcium. If you said this is part of the sinotubular junction, which honestly, I think it's still part of the leaflet. So I'm gonna go ahead and fix it back just for the practice. So again, if you go to the bottom, right or left, let's say this time the right side, you just take it up, and now you include that. So this is, let's say, how you exclude any calcium that should not be part of the aortic valve. Once we're done with this, you go to the right side where there is the option where you change the number minimal 130. You go to segment, click on segment. And it's gonna ask you, this is the Agatston, as I said, like before, the number we use for the cutoff, the 130, the slice thickness, 3 millimeter, all of this. So you just agree, and you say, okay. So this is gonna give you a calcium score. So the calcium score total here is 258. And to some degree, it does a good job, especially for the tricommissural or tricuspid aortic valve. It will give you each leaflet calcification. You can adjust, by the way, which leaflet is which. So let's say if you do not agree with the right leaflet, it should be somewhere there. You can adjust it. So this is something also, sometime if you don't agree with this, like for instance here, if you think this is more non-con, I can take my cursor here and just take it off a little bit so this becomes more non-con. Anyway, and again, you can go ahead and segment again, and it will give you the measurements. So the calcium score here total is 258, and this is, let's say, a 7-year-old woman, so this will be a low calcium score. Any question about the calcium score? We can do another case quickly, and then we can go to the TAVR where the money is, how to measure the annulus. All right, so let's go ahead to the patient list. And the same thing, just change the number from 07 to 18. Keep the same thing, that will be easier. So MW underscore 18 underscore CT. And you should go and find, let me tell you which phase has the calcium score. It should be the number 52 images. Go ahead and right click, the one with 52 images. And I'm gonna, this time, just do it while you're doing it your own. Again, you double oblique. So once you double oblique the aortic valve, say you're happy with it. Now from here, you go to, again, the drop down next to the distance measurement, valve calcium score, aorta. Notice how the settings saved for you, the minimal Hounsfield unit 130. So here it becomes just like defining the aortic valve location and agreeing on the height. So I'm just gonna go back and forth. So for instance here, most of this is sinotubular junction calcification. So I'm gonna exclude it. So I come down on the valve. Let me just zoom in so it becomes easier. So we come down, down, down to exclude that calcium. This is still part of the sinuses and sinotubular junction, so I'm gonna come down to exclude it. Even this one. Let's say we agree with this. Let's come down, make sure we're not including the left main or the LVOT calcification. I think this can come down further. All right, so let's go ahead and segment it. And the calcium score total is 109. Again, mild aortic valve calcification. So any question about the valve, aortic valve calcium score? Again, remember, this has to be non-contrast CT. Slice thickness has to be 3 millimeter, the same way we do the valve calcium.